Hi, this is Dr. Judah Thornwell, Principal Investigator with the Rapid Alliance STAR Study in the National Science Foundation Center for Health Organization Transformation at the University of Louisville. You probably learned about this by hearing about the Medications 360 study or the Rapid Alliance. This is focused on addressing one of the biggest public health challenges in the United States, and that is the non-optimized use of medications and vaccines. And it's all come to a head, if you will, during the COVID pandemic. And we're trying to do something about it at scale with potential to save millions of lives and as much as $528 billion of likely avoidable spending per year. So how do we do that? The background on this is that in the middle of COVID-19, we were asked to do a study of how we could optimize delivery of vaccines and tests and medications through U.S. pharmacists and pharmacies. And that led to a broader analysis of the overall sector that is presented in a report called the Rapid Alliance 2021 report, which you can download at rapidalliance.org. We then constructed a research context to really try to tackle this and similar problems at scale. The Rapid Alliance STAR study is a 5-year study. It's IRB approved. It's multi-project. And the mission is to advance knowledge about how to accelerate the development and spread of transformational innovations for improving health in society. And we've structured this so that you, at the top on the right here, have the Rapid Alliance STAR study as kind of the umbrella home for everything. We've got the Rapid Alliance Research Consortium for the medication space. The Medication 360 study is expanding that to all medications and vaccine stakeholders in the U.S. as well as internationally. And there are going to be many, many study sections as we build this out. Why is this important? Because COVID-19 is a wake-up call that we need to learn as human beings in society to do much, much better at quickly getting transformational health innovations out to market. Well, that's where the new science of service-dominant logic and service ecosystems come in. It's all about co-creation. Services in a service economy, it turns out, are always co-created. People have to talk about it to understand what it is. In contrast, goods or physical products, the logic of those are manufacturing, distribution, consumption, right? And services don't work the same way. In addition, it turns out you have to study service ecosystems with actors who aggregate resources, use that to co-create artifacts and services and apps, and then this is all governed by institutions, and all of that needs to be continually co-created to make a difference. And who should be doing that? Well, by definition, it's many universities, many researchers, many research disciplines working in collaboration with many key actors across the ecosystem, including government, associations, for-profit, nonprofit, national level, state level, international level. And that's the framework of service-dominant logic and service ecosystems. We've developed a new theory to help make this happen at scale. This, again, is new science, and this is grounded in what we actually did last year and tried to analyze what worked. You start with the population health risk. You convene an ecosystem of stakeholders to do the co-creation, and you start with shared purpose, co-creating a strategic plan, strategic frameworks, research priorities, and so on. And the result of all of this effort and these measures and these processes is, as a goal, faster development of innovations and better health for all. We have a method for doing this called the STAR method, Scalable Transformational Action Research. It basically brings all the key leaders and experts from the practice community doing the real work together with key experts and scholars from the research community to conduct the research. And so you organize these structures so we can co-create at scale. And the reason we can do that is because we're using and can use new collaboration tools and technologies that have never before been available in the history of the world. So it's pretty cool. Related to this, we've developed a new digitally supported research regatta method that allows many people, even thousands of people, to come together and form many different small groups, small boats of 7 to 15 people working in expert panels who all row together on, if you will, in a regatta kind of model towards this shared goal. It's a way of doing really large-scale fast-track planning and a consensus building and education across an entire ecosystem to get something done much more quickly. And if we're successful, everyone on the shoreline cheers all of us because we did a good job. The outcome measures, as mentioned, better health and well-being. That's what we care about. We are public health people, and there's more and more measures that are available to be used globally, EU and the US. We think the ethics of this are centrally important, and we're advancing something called intrinsic value theory and methods, intrinsic value ways of relating. We think to optimize co-creation, we need to have a commitment to honoring and respecting each person in each conversation and interaction anywhere we go as infinitely intrinsically valuable. We cannot commoditize people or turn people into objects of our systems. People must continually be transcending those fixed structures as we learn together to create a better future for all of us. And every person must be seen as infinitely valuable. Otherwise, we run into ethical problems in what we're doing. What are the next steps? Well, get involved with the Rapid Alliance Medications 360 study, or get involved with the Society and Journal of Health Ecosystem Research and Innovation, which is a context that we can all use to speed up our learning and sharing of information at global scale supported by these technologies. Thank you. We're a core team of 6 at the University of Louisville and the National Science Foundation Center for Health Organization Transformation. We've constructed our IRB, by the way, so that other co-investigators from universities anywhere in the US or world can join into our IRB supporting multiple projects. So if you're a researcher and would like to join us, we'd love to co-create this future with you. Thank you very much.